go.
Come in.
Hello, Miss Rutherford. How are you doing today?
Fine. How are you?
I'm good. My name is Amanda. I'm going to be the nurse performing your physical assessment today. Would that be okay?
That's fine.
I'm going to ask you a series of questions, and I'm going to ask you to perform some things that I ask you. If at any time I'm unclear with what I'm asking, just please let me know.
Okay.
I'm going to wash my hands first. Washing hands. Okay. I'm going to come back. Have you been waiting long?
No.
All right. I'm going to go ahead and start off with your blood pressure. Have you had anybody tell you that you've had problems with your blood pressure in the past?
No.
All right. All right, 122/74. I'm going to go ahead and take your radial pulse here. All right. You have a radial pulse of 80. Have you had anything cold or hot to drink in the past few minutes?
No.
All right, I'm just going to have you hold this under your tongue. And while we do that, just going to take your respirations. All right, respirations 20. Your temp is 98.7. All right, I'm just going to ask you a series of questions. Who is the President of the United States?
Barack Obama.
What county do you live in?
Escambia.
Okay, how long have you lived in the Pensacola area?
My whole life.
Okay, you're a native.
Yes.
All right, what I'm going to do now is I'm just going to run my fingers through your head, and I'm just checking for any lumps or bumps or any abnormalities, okay? Do you have any pain or neck discomfort?
No.
All right, I'm just going to come around here, and I'm going to come back up, and I'm just feeling for any swollen lymph nodes. All right, just feeling here for any tracheal displacement, and it is symmetrical. I'm just going to feel for any swollen thyroid, and that feels good. All right, I'm just going to touch your jugular vein. All right, now I'm going to check your carotid and come over here. Feel your jugular there, and then your carotid. All right, what I'm going to do now is I'm going to place pressure on both of your shoulders, and I want you to try to shrug against the pressure. All right. What I'm going to do now is I'm going to place my hand on your chin, and I want you to try to turn your head in the direction of my hand.
Okay.
Go ahead. All right. And now the other one. You're welcome. All right. What I'm going to do now is I'm going to feel for your frontal sinus. All right. You shouldn't feel any pain. You should just be able to feel the pressure. Go ahead and close your eyes. Do you feel any pain or discomfort there? All right. Just come around here. Do you feel any pain or discomfort there? All right. What I want you to do now, if you can, just close your eyes as tight as you can, and I'm going to try to lift them, but try to resist the lift, okay? All right. What I'm going to do now is I'm going to have you close your eyes, and I'm just going to touch you at different places on your face, and I want you to tell me when you can feel the touch, okay?
Okay. Now.
Okay.
Now. Now. Now.
Okay. Do you have any problems with your sense of smell?
No.
You're able to smell okay?
Yes.
What I'm going to do now is I'm going to close one side of your nose, and I'm going to have you take a deep breath through your nose. I'm testing for patency.
Okay.
All right, go ahead and inhale. Any pressure there or
No.
any? Okay. And other side. All right. What I would like to do now is I'm just going to take a look inside your nasal cavity, okay? Just going to lift up on the end of your nose here. Okay. All right. While I have my pen light, I'm just going to shine this in your eyes, and I'm looking for your pupil to react to this light, okay? Just look straight ahead. Okay, and I'm going to come in from the other side. All right, that works. What I would like to do now is test your visual acuity. I have a smell and eye chart across the room. If you could just stand up against the wall. And if you would, cover your left eye and tell me if you can read the letters there.
LTFPH.
All right, cover the other eye, and if you can read those letters backwards.
HPFTL.
Okay, come back and have a seat. At this time, I will grab my ophthalmoscope, and I'm going to look at the ocular fundus. Just look straight ahead for me. I'm looking for the optic disc, observing the color, shape, and size. Over here with my ophthalmoscope, observing the color, shape, and size. All right, what I would like to do now are a few more vision tests.
Okay.
What I would like you to do is cover one eye for me. I'm going to cover the same eye, and what I would like for you to do is tell me when you can see my pen light. I'm testing your peripheral vision at this time, okay?
Now.
Okay?
Now. Now.
Okay. Cover the other eye. And
Now.
okay.
Now.
All right.
Now.
All right, I would just like for you to look straight ahead at me, and what I'm going to have you do is follow the pen light, okay? With your eyes. Very good. Okay. What I would like for you to do now is give me a great big smile. And frown. Okay, what I would like for you to do is, I'm gonna, if you will, just open your mouth and say ah, stick your tongue out for me. All right. That's good. I'm looking at her buccal cavity and her mucosa. You have very beautiful teeth.
Thank you.
What I would like to do now is if you could repeat these words: sight, light, and dynamite.
Sight, light, dynamite.
Okay? If you would, as fast as you can, just move your tongue in and out of your mouth. Very good. Okay, now that same side to side. Okay. Very good. What I'm going to do now is I'm going to give you a hearing test. It's the whisper test. I'm going to close your ear a few times in and out to decrease the hearing sensation, and then I'm going to whisper letters in your ear, and I want you to tell me what you hear.
4, 3, 2.
Okay, now the other ear.
A, B, C.
Okay. Now what I'm going to do is take my otoscope, and I'm going to look in your ear. pulling the ear up and back so I can have good visual acuity of your tympanic membrane, which is nice and shiny and pearly. Alright, same over here.
May I have your attention,
Very
please?
good.
Stations 1 and 2 staff, the morning snacks
What
are
I'm
at the
gonna do
desk.
now
Morning snacks are at the desk. Thank you.
is do a cardiac assessment. I'm just gonna listen to a few places on your heart. There's gonna be 4 areas that I'm gonna listen to. When I get below your breast area, I'm gonna have you just lift your
Okay.
breast. Listening to the aortic valve. Pulmonic valve. Alright, if you will. Tricuspid. And let me get right over here. Mitral. Okay. This completes my physical assessment.
Thank you.
It was very nice meeting you. Do
Thank
you
you.
have any questions or concerns?
No.